Mr. Chairman. Thank you to all of our witnesses for sharing your perspective and your insights. Where do I begin? The cost of health care, pre-inflation, that we've seen in the last couple of years was bad enough, and now it's even worse. I grow frustrated when there are comparisons made that, from the dais perhaps up here, that aren't really reflecting reality. I'm concerned that the overall cost of health care has driven up health insurance plans for workers, public sector and private sector. I marvel at the fact that before Obamacare, I can't quite call it the Affordable Care Act because I don't think that's accurate, but before there was this outsized intervention by the federal government, we had, high-risk pools that existed that, yes, those premium levels were offensive. They were painful. But now it seems that everyone in the individual market, now that they pay a similar amount, it's not as offensive. I worry about things like that. And I worry about the fact that a recent Gallup poll found 38% of Americans delayed medical treatment in the last year because of cost concerns. I worry that the cost of medical equipment and supplies has increased 15% just since the beginning of the Biden administration. Hospitals have seen nearly a 25% increase in labor costs per discharged patient since the beginning of the pandemic. I could go on here with further notes, but suffice it to say that we've got a worker shortage. We had a worker shortage even before the vaccine mandate. Found out perhaps a vaccine mandate wasn't as productive as some would have argued. We've finally gotten rid of that. But there's been a lot of pain along the way. So I hope that we, as a combined body of policymakers and certainly experts with some great insight, that we can have the conversations that we need to have to deliver better results for the American people. I believe my colleagues who supported Obamacare meant well. The results, I think, have been disastrous. I think that my colleagues who supported the spending 2 years ago out into the economy against the warnings of economists, very reasonable economists, against the warnings that it would trigger inflation, I worry that those results have also been disastrous. So as we sort out all of this and hopefully get our country on a better path, certainly as it relates to small businesses, actually workers in whatever size business, I hope I can experience better results moving forward. But Mr. Nicewander, I have to say I'm impressed with your diverse professional background, and I'm guessing that you provide some great services to your community and help feed the world. I appreciate that. Can you perhaps tell us how the rising labor costs have specifically impacted your business across the industries in which you work, and what you would do if the cost of paying your employees increased by another 25% over the next 3 years that we're all fearful of?
So like I mentioned in my opening statement, prices have increased threefold, and we're talking about basic supplies to run a medical office: Band-Aids, syringes, needles, things that are fixed that I can't pass on to the patient, things that I can't control there. We're talking about pennies sometimes, but the price of syringes, for instance, has increased by about 15 cents a piece, which doesn't sound like much, but when you use hundreds a week, that adds up to your bottom dollar. That has impacted us, that we can't offer those costs that we would have maybe paid for health insurance. We can't offer that to our employees. We can't retain the talent that we need. We can't invest in new and better technology to better serve our rural communities that don't have access to those new and advancing technologies. But for me personally, it created a lot of sacrifice. I'm a first-generation cattleman, and since I was 16 years old working on a dairy farm, I dreamed about having a farm. I bought that farm in 2014, and last year I had to sell it in order to keep our medical practice alive and our patients taken care of and my employees' families fed. I don't have another farm to sell.
Thank you. And I don't have a lot of time left, but I hope that we can get to the point where we truly address cost rather than just shifting around who pays for what and saying everything's all better. Thank you. I yield back.
And now,